Today on the Dr. Oz Show, Dr. Oz has the fix for your biggest problem areas.
You like that, don't you?
The revolutionary procedure to freeze your fat off.
No scalpel, no anesthesia is needed.
How to get rid of your bra bulge forever.
This is never coming back ever again.
The miracle shot that will take years off your face.
That is a big difference.
Plus, erase wrinkles, round spots, and cellulite without plastic surgery for under $100. Next.
Welcome to a special show called The Fix. Today, I'm revealing how to fix your biggest problem areas in no time. From cutting-edge plastic surgery to non-surgical alternatives for under $100. Now, this is a show that will make you look younger and feel better. I've got some amazing procedures and incredible new products that you have never seen before. And the first fix is a lunchtime procedure that's going to revolutionize the fight against fat. We're about to freeze someone's fat off live on this stage. Could it be right for you?
It sounds like science fiction, but it's now a reality. A revolutionary, non-invasive procedure that's giving liposuction a run for its money by literally freezing away your fat. The inspiration for this cutting-edge technology? A research paper from the New England Journal of Medicine written 40 years ago that showed how children who habitually sucked on popsicles developed dimples. The reason? Exposure to constant cold caused loss of fat tissue in their cheeks, a syndrome the researchers called popsicle paniculitis. 40 years later, doctors applied this research to the battle of the bulge, using intense cold to cause fat cells to self-destruct and become reabsorbed into the body. Now, after 2 years of study, the FDA has cleared this procedure for fat reduction. Could this deep freeze be the ultimate fix for your fat?
Dermatologist Dr. Matthew Abram pioneered this new technology, and he's here with us. So, Dr. Abram, how big of a game changer is this? I mean, it's stunning to me this could even be done.
This is really an exciting development. For the first time, we can non-invasively remove fat. No scalpel, no needle, no anesthesia is needed, with minimal downtime. And, you know, patients now are looking for procedures that don't take them from their regular lifestyle. They don't want to take a week off. There is no downtime from work, from social activities, or for a family. So this is something that really people are looking for. I think it's a really exciting development.
When I first heard about it, I actually confused it with liposuction, which I suspect a lot of folks will do as well. What's the big difference between the two?
They're actually entirely different. This procedure takes advantage of the fact that the fat in our skin is uniquely sensitive to cold. So by applying cold to the skin, it creates an inflammation in the skin, which causes a death signal in the fat cells, selectively just the fat cells, to turn on and make the fat cells, over a period of 2 to 3 months, die, and then your body naturally metabolizes them and moves them away. And with one treatment, we see on average about a 22 to 23% reduction in the amount of fat. Now, this isn't a treatment for obesity. It's not a weight loss device, but in combination with good diet and good exercise, it's really an exciting procedure.
Let me make this real clear, because liposuction, you take a machine in there and you suck out the fat. This works a little differently, and this animation, I think, will show you how it functions. If you actually look at a panis of fat, let's say around the belly, you grab it with this device. And when you do that, you actually are able to pull the skin up and then expose it to a lot of cold. I mean, real cold stuff. And when you get into that cold area, when you freeze the fat, because the fat preferentially gets cold before the skin does, you actually will turn on systems that kill those fat cells. When they commit suicide and die off, then your immune system comes over it, and the immune cells grab these cells that are dead, the fat cells, and takes them away. Now, you still have some fat cells left there, but over time, you'll shrink the total amount of fat that you have, and thus see the shrinkage that we're talking about. Thank you very much, Dr. Abram. Now, because you're not licensed in New York, I've asked leading dermatologist Dr. Elizabeth Tansey, who's here with her patient Estelle, to join us. Welcome to the show. And for the first time ever, we're going to freeze fat off on our stage. Thank you very much for volunteering. So, Dr. Tansey, take us through the steps.
Okay, Estelle, the first thing we're going to do is mark out the area that we're going to concentrate on, okay? And this area right here is the area of focus.
Is she right? Is that the area of focus?
Yeah.
All right. Just making sure. All right.
Now, I'll be applying a gel pad that ensures good contact between the handpiece and your skin.
Feels good.
You want a little help? I'll hold your arms.
Okay.
This is a one-woman deal here, so.
And now, as I apply the handpiece, you're going to feel a slight bit of
Just show everybody
pulling.
this. Just, if you look at the inside, it's just an open space, and the fat that you're trying to suck off is going to be pulled into here. You all see that? Okay. I'm fascinated by this. I love when you can do things less invasively.
Me too.
Okay, so as I apply it, you'll feel that slight pulling sensation. Good. Now that we have
Painful, not painful?
Not painful at all.
now that we have good
I could do
contact,
this all day.
Okay. I don't think it's on yet.
so now that we have good contact, I'm going to turn on the cooling.
Okay.
So you really only feel the cooling for just a few minutes. After that, the skin will become numb. It'll be entirely comfortable. Sit back, relax. It's very easy.
Are you feeling anything yet?
I feel like a little pulling.
But you don't feel the coldness yet?
A little cold.
Not bad.
Not bad at all.
How long does a session take on average?
Each treatment site takes 60 minutes, so literally it can be done over a lunchtime.
And cost, which comes up frequently for these issues?
Well, the overall cost is going to depend on the number of areas we treat. Typically, it starts at $750 and up.
And just a rational expectation, so everyone knows. I mean, how many inches would you anticipate losing with the use of the device?
Well, when we treat all the way around the love handles and the tummy, usually people notice their clothes fit so much better. And that typically ends up being about 1 to 2 inches off the waistline.
And how long does it take for that to happen?
Most people notice the best improvement after 2 to 3 months.
Is it hurting yet?
No, not at all.
Is it going to hurt?
No, that's it.
That's it. What she has is
That's it.
Great.
All right, so I know this is going to take a few months for us to see the benefits, so we actually got some pictures for you, because I was curious to see what this might look like. So here's an expectation, anyway.
Okay.
You can just look up there, you'll be able to see it. So you see that you've got a before and after image, and I must say, I was flabbergasted by this. These are big changes. There's no surgical incision because there's no cut. And here's another example of a before and after. I mean, it's, you know, a couple critical inches that are hard to get rid of for a lot of folks. And I just want to emphasize, and Dr. Abrams said this point, and he's very much on target. This is not a replacement for dieting. I still want you to lose the fat. But this is a nice way of getting rid of the last little bit that you have trouble with.
Yes.
All right? I do want to thank you, Dr. Tansey, very much for doing this. And Dr. Abrams, thank you very much for being involved in this yourself. Thanks for being part of this. Our second fix is a cutting-edge, minimally invasive procedure that targets another area women hate most, called the bra bulge.